Hello, fellow rad techs. My name's Nicole Lewis. I'm here to talk about gender-based medicine today. Sex and gender are not the same thing. Sex is the hormones and anatomical features, while gender is the differences between males and females. All right, everyone, we're going to have a little story time. Here we go. I'm at a busy imaging center and I head out to the waiting room to call my next patient. Miss Smith? Miss Smith stands up and walks towards me. She is model gorgeous. Once in the exam room, I ask her the normal questions: her name, her date of birth, the date of her last menstrual period. That's where we run into a snag. She says she doesn't have her period. After asking a few questions to find out why there is no menstrual period, she explains to me that she is transgender. That was my first experience with a transgender patient since becoming an X-ray tech. I knew it was vital that I find out why she didn't get her menstrual period, as the radiologist would come back and ask me about it later. Males and females' bodies absorb and distribute medications differently. What may last longer in a male may wear off quicker in a female, or vice versa. It's important that healthcare professionals know the true gender of the patient that they're working on, not only for medications, but also how illnesses might present themselves. They present different in males and females. In medical imaging, it's important that we know the biological sex of the patient. In mammogram, for example, the films will show up differently. It might also change how you perform the mammogram. In a transgender woman that uses hormone replacement therapy, the breast tissue can look very dense. This can change how the radiologist reads the images. I want to step away from transgender now. Gender in general is important in medicine. There are certain things that are gender specific that are very important for our healthcare providers to focus on. Looking at women in healthcare, they receive less treatment for cardiovascular disease, and when they do get treatment, it's less invasive than their male counterparts might receive. They undergo dialysis at a later time and receive less kidney transplants. These things need to be looked at in healthcare and need to be addressed. These things affect both genders, but it's overlooked because it's typically a man's disease. If we look at men in healthcare, there are diseases that are overlooked with them as well. Osteoporosis is overlooked. Depression tends to be labeled as a woman's disease. And even breast cancer. Men can get breast cancer just as easily as a woman can. All of these things and many others are overlooked. Regardless of your gender, your health care is important. Your disease should be diagnosed, whether it's osteoporosis in a man or cardiovascular disease in a woman. It should be paid attention to. It should be diagnosed. There are ad campaigns underway that help promote these diseases that go undiagnosed in specific genders. Medical personnel is being trained to recognize these diseases in the genders that they were previously not as recognized in. There are changes coming, and it's much needed. Thank you for joining me, everyone, as we talked about gender-based medicine today. I hope you understand how important it is that as healthcare professionals, we pay attention to the gender of our patients. Their biological sex is important. I understand that they may be transgender, but we do need to pay attention to that biological sex. It could impact how we give care or what the radiologist finds. Thank you for joining me. Have a good day.
Created using Powtoon.